Joining me now, Arkansas Governor Asa Hutchinson, the chair of the National Governors Association and a key player in yesterday's meeting with the president. Governor, thank you so much for being here. Yesterday, you said the federal government was helping your state secure more monoclonal antibodies. You mentioned the pressure on the testing supply. Let's talk about the challenges that are still ahead and whether the administration is doing enough to address the challenges, particularly in your state.
Well, the public needs to understand that during this difficult time, the governors and the administration, we have to work closely together. And that was the most significant thing about the meeting with the president yesterday, with the governors, with the administration, that we're all focusing on solutions. What the governors needs are flexibility, as the president indicated. Many of the solutions have to be state-oriented. Secondly, we need the support from the federal government in terms of the supply chain. Whenever we have a shortage of monoclonal antibodies or other therapeutics, it's the federal government that helps us to get that supply. Testing is in scarce supply right now. We need their help to make sure that there's adequate supply, not just for the federal solutions and the president's goal of 500 million rapid tests that are available, but we have those available in our supply chain at the state level, so we can put them in libraries and make them available more readily to our citizens. And then, it is the consistent message that is important. I applaud the president. While we disagree on some strategy issues, I do appreciate him depoliticizing this effort. We're all in this together, and it doesn't make any difference of your partisan stripe. Let's get the vaccinations out, and there's a greater cohesiveness about the importance of vaccinations now than ever before.
I want to ask you about that in a moment, but first I want to ask about the CDC's new guidance on quarantine and isolation times. Did you get a heads up about that, and how will it impact your state? What is your health department's take on it? What does it mean for Arkansas?
Well, first of all, it's great news, and we raised that issue. I believe it was another governor that specifically raised the issue of needing to shorten the quarantine time. Particularly, we did it for our hospital workers. It needs to be more broadly for the workers. It was later that day that CDC issued the guidelines, the revised guidelines. And so, one, they're responsive. They listened to us, and they did indicate that they're working on that. Hopefully that accelerated as a result of that conversation. But we're going to be making an announcement later as to how we're going to address that in Arkansas. We accept the CDC recommendations because the greatest time of spread of the coronavirus, the risk is in the first 5 days. But we also have to minimize the time of students being out of the classroom, the time for our workers not being able to participate in providing for their family or moving their economy forward. And what the president has signaled, and which we've advocated for, is that we know the solutions: vaccinations, testing. We've got to concentrate on managing our way through it. It's not a time for shutdowns. It's not a time for repressive measures. Let's work our way through it and all survive together to keep our economy going, at the same time addressing the urgent need of our workforce and our increased vaccinations.
I want to ask you about vaccinations. Roughly 30% of Arkansas's fully vaccinated adults have gotten a booster shot. Experts say that is especially important, that older folks, those at high risk, get boosted. What are you doing to get those numbers up?
Well, I agree totally. It's critical that we not only get the early shots, but the booster is important, particularly for the elderly population most at risk. And those numbers are going up consistently in Arkansas. We have to accelerate that. And today in Arkansas, we have a large number of new cases. We've got an increase in hospitalizations. And as the public sees this, they become increasingly aware. And we educate them on the importance of the booster, but also trying to increase those that start the vaccination sequence. We have over 50% of our population that's been vaccinated, but we got to increase the boosters, and we got to raise that level of total vaccination. We understand the importance of it, and people are responding to it. Mandates don't work in a state like Arkansas at this time, but the education does work, and people are very aware of the risk that's out there. We continue to focus on that message and depoliticize it, so we're all on the same page trying to increase those rates and the health care of Arkansas.
Governor Hutchinson, thank you so much for being with us today. We really appreciate your time. I know governors all across the country are so busy trying to keep their states safe right now. Thank you.
Thank you. It is good to be with you today.